and we get on to colposcopy. श्रेया कुछ सवाल पूछने मॉर्निंग की उसमें?
नहीं मैम.
All right. Yeah. That's it. हैंग हो गया. मालती ये हैंग हो गया, क्या करूं? Now, from the very basics, and I will take you till tomorrow on advanced. 24 countries joined American Society of Colposcopy and Cervical Pathology in 2013, and they came with consensus of guidelines. For colposcopy, you require acetic acid solution 5%, and this is prerequisite. It has to be applied to the transformation zone before anybody makes the impression. As far as endocervical sampling is concerned, previously we used to work hard and try by smallest curette to take out curettings from the endocervical canal, and now it is said that there is no need of curette. Use an endocervical brush, and that will do a great job. Transfer the cells onto the cells, fix it up, and then the pathologist will do a great job of evaluating the endocervical pathology. Now, same is for endocervical assessment. Endocervical assessment, something you can look at it, and then you have the rest from the endocervical brush while you're doing a colposcope. Now, as far as the biopsy is concerned, colposcopic directed biopsy, it has to be either one take a very big punch biopsy, or one should take a loop electrosurgical excision procedure depending upon what kind of lesion are you seeing. So these are the two things, either to take a big punch or take a lead. The conization also, people have said that one should not do the traditional conization because that is bloody. But either you should do a core life conization or you should do electrosurgical conization. What do you mean by adequate colposcopy? Adequate colposcopy, you should be able to look at the cervix, whole of the transformation zone, all around it, and part of it should not be left behind. And then if you are examining both the squamocolumnar junctions and the transformation zone, then only you say that it is a satisfactory or adequate colposcopy. Now, when an endometrial sampling needs to be done, whenever a patient beside the cervical pathology has an additional endometrial problem in terms of heavy bleeding, scanty bleeding, irregular bleeding, these patients need to have an additional endometrial sampling done at the time of colposcopy. The other category of patients which also require endometrial sampling is whenever there's atypical glandular cells on cytology, on a pap smear. Atypical glandular cells. The glandular cells can come from the cervix as well as they come from the endometrial cavity. So there again you need to do endometrial sampling, and I will tell you exactly how in a very simple way you can do an endometrial sampling when you do when you're doing a colposcopy. Then anybody who was found to be positive for HPV infection thinks that I have got a cancer. But this is not, you can see a large number of population can be positive for HPV, but a very small number of patients will develop cancer. 11 out of 1 lakh cases in a general population, and where HPV is positive, you find nearly 25% people will have different kind of low-grade lesion or a high-grade lesion, and a very few small percentage will develop cancer. Now, this slide is very important and very simple at the same time. Whenever HPV infection gets into the cervix, it stays there. There is a repeated exposure, and then you find the virus is having a slight incubation period has passed, active growth has occurred. The host immune system comes for a defense, and then the tussle goes between the two. And at the end of almost 9 months to 1 year, the settlement has to take place between the active invasion by the HPV and the host containment. And then they decide about it that there is a clinical remission. So once the cells are out, they are out. But if the cells decide to stay on into the cervical epithelium, the DNA of the HPV combines with the DNA of the cervix, and then whole lot of preclinical cancerous lesion will get started. Now, this is a $1 million slide, and this slide will come from my presentations to 4 times. The question is asked by Dr. Shada Jain to you: what is the percentage the patient will progress to invasive cervical cancer? And the answer is 1%. Over 30% is over 30%. Now, this is the slide which summarizes what all pathologists give you the report. This is the different kind of report comes as an abnormal pap smear to you, and we will take each one of them, and each one has an importance. Whenever there's an atypical cells comes, the pathologist becomes uncomfortable. Then and when they find he cannot make up his mind, then they write down of ASCUS and unknown significance. Then there is a low-grade intraepithelium, there is a high-grade intraepithelial lesion, which is mainly CIN2 and CIN3. Glandular cells can present as atypical glandular cells, and whenever you have atypical glandular biopsy, you have to do endometrial biopsy as well. And then there can be patients of endocervical adenocarcinoma in situ or frank adenocarcinoma. So this is what you are used to it. कि जो pathology की pap smear की report आती है, उसमें ये सब abnormal pathology आती है, where the gynecologists have to take a decision कि क्या करना है. 2019 में एक और ad हुआ, people were not happy. They used to write down the cells are not enough, so the final comment cannot be made. So the pathology association made it कुछ नहीं काम चलेगा कि cells कम है. आपको दिखाई दे रहे उस पे comment करो कि whether there is a malignancy, whether there is a dysplasia. So now they have started writing this from 2018, and you find now pap smear report is almost complete. Now this slide I showed you this morning, that any of the HPV 15 viruses में कोई पॉजिटिव हो और जब भी ये abnormal pap smear पॉजिटिव हो तो आपको colposcopy करनी है. Now indication for colposcopy is what? The indication of colposcopy whenever there is an abnormal pap smear, where there is a persistent vaginal discharge, where there is an unhealthy cervix, and those the kind of thing. But basic reason for this is the purpose of cervical colposcopy is from where to take the biopsy. From where to take the biopsy. In cut short, whatever the indication is colposcopy is, इसका purpose है कि कहाँ से biopsy लेनी है. So So for that, I told you adequate colposcopy means adequate visualization when you can see the whole of the cervix, you can see the entire transformation zone, and you can see the part of the endocervix. So objective of colposcopy, from where to take a biopsy. Basic idea is that in that particular given case, हमारा काम है कि उसको invasive cancer है कि नहीं है, and identify where the disease is. Now, you put a speculum and you find the cervix. It is seen instantly when you put a speculum. So the success of colposcopy lies in visualizing the cervix and its transformation zone in entirety. What is benefits of colposcopy? Benefit of colposcopy is it is never done in theater. It is always an outdoor procedure. It is outdoor procedure. No anesthesia is used anywhere in the world. So gynecologists in India who are doing it in the theater, they want to make things very expensive, and just public के लिए बना है, उससे वो दूर चली जाती है investigation because it becomes expensive. Now, it helps precisely to examine the cervix and the transformation zone, and then after staining, the doctor makes up his mind from where to take the biopsy, takes the biopsy, ensures that the hemostasis is obtained, and this is done as an outdoor procedure, never the anesthesia, and only few minutes it takes. You need to involve your patients when you are doing a colposcopy in looking at the picture, so she gets also involved in the decision making. And this is what is going to be right from the normal colposcopy. You should be able to say this is original squamous epithelium, this is columna, this is transformation zone. So everything you will be able to identify till the end by the time your meeting today and tomorrow is over. So in a normal colposcopic finding, आपने जब acetic acid लगाया तो आपको देखना है कि वैसे acid-to-white lesion is present or not, and then grade it. Grade into 1, 2, and 3 lesions according to you. कि आपको कैसा लग रहा है, mild लग रहा है कि moderate लग रहा है कि severe लग रहा है. Then depending upon क्या उसकी whitening है and what is the degree of opacity it has. Then after that you put a Lugol's iodine and you see whether that area is taken up a brown or a black stain. That area is healthy, and the area which does not take up an iodine stain is unhealthy area. Then you need to see the vascular pattern. में एक दो conditions हैं जो कि I will talk in detail about it. Punctation and mosaic आपको देखना है ये है कि नहीं है. Presence of that does not say that it is a higher grade or this is a cancer. You need to show the presence that shows that it is साथ-साथ में epithelium के साथ-साथ में vascular pattern is also involved. And then there are certain atypical vessels which you can find on the surface and which you can see naked eye as well as you can see through the colposcope. And there is a term keratosis. आप बिना unstained cervix को देख रहे हैं and sometimes you find there a white spot. And when the white spot coarse keratosis is there, that means cancer. I'm going to show the slides and things will become a permanent picture will be there in your mind. Now, a different तरह के graph eye cervix में किस तरह बनाओ, इस तरह से करो, but they were very complicated. And all of us now use a simple cervix photograph, and we, depending upon which, according to clock, you say 3 o'clock, 4 o'clock, 5 o'clock, or 6 o'clock. If the lesion is there, you make a lesion, and then you say. So it is, it is on the file. It is well documented. So you know it was at 5 o'clock position or it was at 9 o'clock position. We exactly know what has to be done. Now, the original, this is the endocervical. The red area is endocervical canal, which is lined by the original columnar epithelium. And the outer cervix is lined by the squamous epithelium, which is a mature squamous epithelium, and the junction between the two is called original squamocolumnar junction. Now, as the age advances from the time the person is advanced, this epithelium goes outward. When it goes outward, inside you can find there is a new squamocolumnar junction, and the old squamocolumnar junction goes on the outer portion of the cervix. And this white area which you can see is originally it was columnar epithelium, And now with the exposure of the vaginal acid, now it is trying to become a mature squamous epithelium. So on the right, on the left hand side, on the right hand side of the white area, you can find this is a mature. This is the mature squamous epithelium. This is the mature squamous epithelium. But the white area has got immature squamous epithelium. Patches will be there of mature, immature squamous epithelium. And this whole white area between the new columnar junction and the old columnar junction is called transformation zone. And its significance है कि it has got columnar glands की opening इसमें दिखाई देंगी और इसके बाहर कोई glands की इस particular mature area में कोई glands की opening नहीं दिखाई देगी इसमें कोई glands की opening नहीं दिखाएंगे खाली glands की opening यहाँ पर दिखाई देंगी. Now this is what the picture becomes very clear again. This is columnar epithelium. This is mature squamous epithelium, and this is a transformation zone which has got immature squamous epithelium. And this is highly active, and when it is get infected with HPV, it will cause, slowly and gradually, it will cause problem of precancerous lesions. Now see it very clearly. All these things are gland opening. These are all gland opening, gland opening, gland opening. See it very closely, then you can find a gland. Sometimes you can find it is the opening is closed. So these are all gland openings. So you can find all around it. You make a circle, and then you say it is a transformation zone. Again, you can see the whole transformation zone. This is endocervical canal, and this is transformation zone. After beyond this particular line, you don't see any columnar epithelium. Columnar gland, this gland openings you do not see. इसके बाहर आपको gland opening नहीं दिखाई देंगे. यहाँ पर columnar epithelium में glands opening दिखाई देती है जो columnar epithelium की है वो only in this particular area they are there. You can see good gland opening, gland opening, gland opening, gland opening. All both of you are clear, Shreya and Dr. Shakuntala?
Yes, ma'am.
Yes. This particular thing again tells you what is ectocervix, what is endocervix. Ectocervix is lined by the multi-layered squamous epithelium, while endocervix is lined by columnar epithelium, which is a single layer. Squamocolumnar junction, and I did tell you that once this dysplastic epithelium gets infected with HPV, it will cause precancerous lesion. Now, transformation zone, another fact, one thing is gland opening. Secondly is, it is not a complete circle. Some area it can be bigger, like here in this anterior cervix, it is a bigger area, while in posterior cervix is very small area. On the sides, it is like this. Here, you can see, it's one cannot say. Depending जहाँ gland होगी, उस glands को बस जोड़ते चले जाते हैं, and that becomes your transformation zone. Cervix, it is more pouting, and this is more ectopin kind. This is highly magnified view showing you the gland opening, showing you all columnar gland opening. Whenever you find opacity like this, then it is, you already know this is the case of CIN2. Cuffed gland opening. Now these are the Nivothian follicles. You can see on the ectocervix, Nivothian follicles. This is the transformation zone, and because these follicles are gland opening are blocked, and that's why they have taken a shape of follicle. If they are still bigger, then you say Nivothian cyst. In colposcopy procedure, you have consent is very, very important. And you take a consent, we'll show you how we take a consent, and then this particular lithotomy positions you have to secure, and then you have to start working. You'll be shown all the instruments tomorrow morning. Steps क्या है कि when you look at the cervix, you clean it up with saline in case if there's a discharge. If a newer colposcope have a filter, and you put a green filter and then see the blood vessels properly, apply acetic acid. After that, you apply Lugol's iodine. Then make up your area from where to take a biopsy. Take a biopsy and have a control of bleeding before patient leaves your place. Now here you can see the cervix, which has been there. It has been cleaned up and then after the clean, there had been little discharge here and there, and after this has been cleaned with the cervix, with the saline, you can find as a good clean cervix, and this is also you find a good clean cervix is there. This is you put a filter, and you can see once you put a green filter, you can see the blood vessels like this, and then this filter absorbs the red color, and the blood vessels become black. This is the way it looks like, but a few old colposcope do not have filter like this, but this is, for people who are keen students of colposcopy can understand the vascular pattern very well. Now then you apply acetic acid. 5% acetic acid. We will teach you how to make acetic acid every time when you do a colposcopy. It has to be made fresh. जब भी आप बनाए colposcopy करेंगे, हर बार fresh acetic acid बनाएंगे, and it's very simple to do this. Once you apply this acetic acid, there's a coagulation of the cell protein will take place, and this gives the opacity to it. ये coagulation of cell protein होगा, उससे इसकी opacity आएगी, and it takes almost 1 minute for you to repeat after repeated application to make up your mind. And this coagulation of protein gives rise to opaque area, which can vary in thickness from a very light to very thick. And that opaque area, that white area, and opaque area, and dense area is a cause of concern and an area of concern. Acetic acid लगाने के बाद it also fades away in 1 to 3 minutes time, so you have to do a repeated application before you really make up your mind कि किस area से which area is abnormal. Now again you have to see the transformation zone, and transformation zone will stand out because of the gland opening को अगर आप join करेंगे तो देखेंगे. तो आपको देखना है इसकी intensity क्या है in three grades में, duration of stay क्या है, speed of appearance, speed of disappearance, and the margins related to squamocolumnar junction उसके अंदर है कि उसके बाहर है. Grade 1 is like a snowstorm appearance, so it is called snow white, and usually अगर आपको histopathology करेंगे तो ये CIN1 होगा, and invariably HPV will be also positive. Sometimes the HPV, these in Indian labs may not be positive at times, but that does not mean that patient does not have HPV. Grade 2 में it is flat, more whiter than snow white, and you find it's a gray white. Irregular vascular pattern may be there, and the diagnosis can vary from CIN1 to carcinoma in situ. Grade 3 में जो boiled अंडे का छिलका होता है, boiled अंडे का जो छिलका होता है, उस तरह का dull oyster white, gray aceto white lesion will be seen. It has got irregular surface, contour, and irregular course. Coiled vessels may be there, and the margins, edges may be raised. Again, it can vary from carcinoma. CIN3 is a bad lesion. It is CIN3, or it will be carcinoma in situ, or it will be invasive cancer. Now, आपने ये patient है, उसको acetowhite lesion भी डाला, कोई भी acetowhite lesion नहीं आया. Done. But you can see this is the small transformation zone which you can see in this particular patient. Now this is a patient, you can see a little ectropin kind of things, it has been there. It is before acetic acid application, and this is after acetic acid application. You can see all small gland openings. Can you see? These are all small gland openings. Gland opening. So this is, you can find, it is we graded as grade 1, and this was again found to be CIN1. Again, you can see this was when you applied acetic acid, all 4 quadrants of the cervix became white, and they became grade 2 opacity was there. It is ये अंडे वाले छिलके जैसा नहीं है अभी, तो grade 2 थी, और उसकी confirmation was also that it was a CIN2. Now in this particular area you can see different irregular patches have been there. At times the opaque area has been there. It is little more magnified. You can see these are the dense opaque area. These are the dense opaque area. And again this was grade 2 we said, and finally it was turned out to be CIN2. And CIN2, if you take a biopsy from this area, it will come to CIN2. If you take a biopsy from this particular area, probably it may be CIN1. So you need to take a biopsy. कहाँ से लेनी है? आपको जितना ओपेक एरिया है, जितना ज्यादा ओपेक एरिया वहां से लेगा, या जो हल्दी वाला एरिया है वहां से लेना पड़ेगा. Now you can see here the opaqueness is really dense. बिल्कुल कहीं पर भी दिखाई कुछ नहीं देता underlying tissue. So we graded it as grade 3. It also was confirmed as CIN3 and she was also HPV positive. You can see here again, this area, dense area, it has been there. And this shows an inner border sign also. There's an outer, this thing is a raised margin, and you can see it is a light area, and this is a thick opaque area. So whenever you find there is an outer border and there's an inner border which shows a thick opaque area, this is called an inner border sign. And this shows that if you take a biopsy from this particular area, it will show a high grade lesion of grade 3 or grades 2, 3, or even cancer. You remember this, I'm going to show it again tomorrow in the video. You can see the margins are very well defined, clear, and it is a raised surface. It shows a higher grade lesion. Now this is the Lugol's iodine. Lugol's iodine, it comes as a pre-prepared bottle. You have to just shake it up and use it. Put it up on a syringe and then you can use it. The area which takes a dark brown stain, that shows that's a healthy area. The area which does not take a stain, that is a pathological area. Again, this fades away in about 8 to 10 minutes time. Why it takes up a brown stain? Because there's a epithelium has the glucose in it, and that is why when iodine combines with the glucose, it will turn it brown, dark brown. This is a very favorite slide of mine. Many times after cancer, after cesarean section, cervix looks as clean as this. And when she comes for a postpartum visit at 6 weeks, we are supposed to take a pap smear, always. If you, you put a speculum and you want to take a pap smear and you find cervix is looking very healthy, you attempt कि इसके patient के 300 रुपए क्यों खर्च किए? तो उस time पे one should not try to work on those lines and take a very sincerely the pap smear and the report came as CIN2. You should not be surprised. आप लग रहे इतनी सुंदर सर्विक्स दिखाई दे रही थी, इसका CIN2 कहाँ से आ गया? And then when you stain it up, you can see here rest of the area is brown, but this particular transformation zone area shows opaque area. If you take a biopsy from this darker opaque area, and the confirmation comes as CIN2. Whenever you find sprinkling of things like this, stippling kind of a thing, you can find there is an extensive HPV infection. HPV infection. So this is an area which has been stained with the Lugol's iodine. This is a healthy area. This is an area which is abnormal, and biopsy अगर लेनी है तो मुझे इस healthy वाले area से लेनी है, where it is mustard color staining है, ज़्यादा opaque है. This area is more opaque than this particular area. If you have to take a biopsy, I will not take a biopsy from this area. I will take either the biopsy from here or I will take the biopsy from here. जहाँ पर ज़्यादा opaque है, वहाँ से biopsy लेने का फायदा है. If I have to take a biopsy in a whole area, I will take a biopsy from this area. This is anywhere you can take a biopsy because everywhere it is a mustard yellow. Mustard yellow. And here, this particular patient, again, patient had a CIN1 report, LSIL ki report आई इसकी, and then we did a thing, and we could find that here, we could really not make up our mind after putting up acetic acid. You can here see the glands were here. You can see all these glands. But this became very clear after Lugol's iodine. We took a biopsy from this area and it confirmed the diagnosis. When it is more ectropion kind of anything, थोड़ा सा और फैल गया बाहर की तरफ, we call and this is a type 2 transformation zone. This is type 3 transformation zone कि आपका सारा कुछ अंदर चला गया है, आधा चीज दिखाई नहीं दे रहा. This happens in menopausal patients. You can see here a metaplastic opening, gland opening, how beautifully things are stained. You can here see all these gland openings are very well beautifully seen. Very well beautifully seen. You can see here the gland opening. Dr. Shreya, Dr. Shakuntala, these are all glands. You can all see all glands. This is a highly magnified view. So same glands are expanded, and there's a cuff around it, white cuff around every gland. That's why they call cuffed gland opening. Whenever you find cuffed gland opening, आप मान के चलो patient को CIN2 होगा. Now, if one has to take a biopsy, black area shows it is a mature squamous epithelium. Mature squamous epithelium, mature squamous epithelium. And the yellow area, haldi wala area, this is an area which is abnormal area. इस area से biopsy करनी है. काले वाले area से biopsy नहीं करनी है. इसमें से अगर हमने pick up करना है तो जहाँ हल्दी वाला area है, you have to take a biopsy from there. Now this is I was talking about keratosis. You have not put up any stain. ना आपने acetic acid डाला ना कुछ है. But you find the white patches like this. This particular patients need to be seen very clearly. Then that was fine. This was fine, keratosis. Now, this you can find white spots. No staining has been done. White spots. This speaks cancer. These white spots, we have not done any staining. This speaks cancer. You examine that particular patient, cervix dekho, vagina dekho, make up your mind. Then we finally make up a mind after doing VIA and Billy, we make up mind which area we will do it. We take the biopsy, big punch biopsy, or we take a leaf. We will talk about it tomorrow. कब करना है और उसके बाद आपने hemostasis जरूर करनी है. And for that we make arrangement how to do it. This slide I'm repeating it again. अगर आपको biopsy लेना है, this is an area which is healthy area, dark brown. यहाँ से biopsy नहीं लेना. Area unstained area से लेना. तो हमें अगर कम unstained area से लोगे तो आपको lower grade of lesion दिखाई देगा. opaque area से दोगे, healthy वाली ऐसे area लोगे, उसी cervix में आपको CIN3 lesion दिखाई देगा. उसी area में periphery में चलेंगे तो CIN मिलेगा. उसकी periphery में चलेंगे CIN1 मिलेगा. इस periphery में मिलेगा CIN1 मिलेगा. Pathologists can grade it in three terms करके भेजेंगे. CIN1 भेज सकते हैं, low grade करके भेज सकते हैं, कोइलोसाइटोसिस स्पेयर करके भेज सकते हैं आपके पास. हाई ग्रेड में CIN3 बोल सकते हैं, हाई ग्रेड करके बोल सकते हैं. कुछ डिपेंडिंग अपॉन ट्रेनिंग कितने ने कैसा सिस्टम अडॉप्ट किया है उसके हिसाब से वो लिखेंगे. बट आपको क्लियर होना चाहिए फ्रॉम वेयर टू टेक द बायोप्सी. Unsatisfactory colposcopy is when the whole of the squamocolumnar junction is not visible and proper full transformation zone is not visible. So this is what you can see. आप कितने भी कोशिश करोगे, around right hand side of this particular cervix will not be seen. So it is unsatisfactory. Again, आप इसको कितना भी pull up करोगे anteriorly, आपको posterior part of the cervix will not be seen. The left side of the cervix will not be seen. This you can see here. It is a menopausal patient. Half of the active cervix has gone into the endocervical canal. Again, whole of the cervix cannot be seen. Unsatisfactory. Miscellaneous में we will talk about this punctation and mosaicism tomorrow, but this is a polyp you can see here. Polyp you can see here. This is an inflamed chronic cervicitis, which gives almost the exact look. These are Nibothian follicles, which have taken a form of a big cyst. So now we call them Nibothian cyst. These are Nibothian follicles, blocked columnar epithelium. Condyloma, we all know about it, that they can be flat, they can be papillary, they can be spiked. Whenever you have spread out like this, stippling, आपको मालूम चलेगा कि ये extensive HPV infection आप देख रहे हो. These are micropapillary warts. ये आपकी exophytic growth है. You can find exophytic growth, exophytic growth, exophytic growth, mustard yellow stain, exophytic condyloma. This shows an atrophic postmenopausal epithelium, atrophic cervicitis, ectropion I was talking about. Sometimes you have a TB infection, trichomoral vaginalis infection, and you find appearances like this. But when you stain it with white, it appears this way, and leopard skin. you can find all brown, and these are the area of infected glands. Sometimes you think, there are lakes of blood are there, and atypical vessels, big lakes are there. Probably it's a malignancy, frank malignancy. But when you surprisingly sometimes you find a diagnosis of tuberculosis from the pathologist. A bit this thing. Any questions? क्या हुआ? Any questions?
No, ma'am.